Hi guys.
Hello, hello.
Welcome back to Monday Night Mythbusters. I'm Dr. Carolyn George from VIDA Integrative Medicine and soon to be VIDA Nutrient Infusions, and Leslie Harrington, Transformational Coach.
Hey guys.
So we are talking tonight about IV infusions and the potential benefits from that. So if anybody's ever had one, I love if you kind of give us a shout out and say what you have had and if you found it helpful. So hey there, Nick. Hey, Marianne.
Hi, Nick. Hi, Marianne.
So we've got some others joining us. So give us some feedback in terms of whether you've ever had an IV. Could be for an emergency, could be for health reasons, it could be for nutrient infusions. So let me know if you've had any of those, and then we can talk about the benefits. Okay? So I embarked on this area because I had noticed that a lot of my patients who are having a variety of different health issues had gone to places that offered the IV nutrients, and it can be vitamin vitamin C, the B vitamins, glutathione, these types of things. So it could be that. Or it could be just fluids. So you can get a variety of different kinds of nutrients. You could do amino acids. So I would notice that when they'd had these, that they came back in and they were feeling much better. So I started asking, what were you doing? How did it feel? And do you think it really made much of a difference? And by and large, they really thought that it made a significant improvement. It wasn't the only thing that they were doing, but they did feel that it made an impact. So I started to investigate it. Hey there, Brian. Hey, Sally. So I started to do some investigation and found that in the ER, we've used IVs, IV fluid forever, things that help nausea, things that you can give a lot of medication that way, especially when people can't swallow, can't eat very well. And also you'll use it if you want to give it in a way that gets there quickly. So it's bypassing the whole digestive system. So there's lots of benefits to doing that, but what are the pros and cons is kind of what we wanted to talk about tonight.
Yeah, I can tell you, can I tell you my little background?
Oh yeah, please do.
So with POTS, I lived on IVs, right?
Mm-hmm.
I was in the hospital all the time, probably every 2 months, maybe every other month, and I was always getting IVs, and they were just regular fluid IVs, and they give me anti-nausea and all these other things in my IV, but one time I was so sick and I was at home and I was like, I cannot physically get myself to the doctor. And I Googled mobile IVs.
Mm-hmm.
Maybe they have this, right? And it came up.
Mm-hmm.
And they ended up having mobile, but the same company had some sites. And I was like, you know what? I might be able to drag my butt over there and bypass, 3 hours in the hospital.
Right.
And I went and tried it. And I went from completely half not functioning to being able to get myself up and moving and feeling good after, which most regular IVs would do for me, but having those nutrients in there was mind-blowing, because then I was even a better version of it. So I think with all of the people that have gut issues and they're not absorbing their nutrients very well and they're not getting what they need in their diet, it was really powerful, and I did it pretty regularly early on. Travel, and I get off of a plane, things like that. So there's all kinds of contexts you can use it in for different reasons, and we'll go through those. So
right, no, there's a myriad of reasons for using them, and it really is kind of being a lot more proactive with your health. And kind of seeing what things you might need. So you don't want to get so sick that you need to go to the ER.
Yeah.
So what things can you do to help? Maybe for a headache, for example, for a GI upset, for example. Jet lag is another perfect one. In the ER, hangovers are another common one. You could hang what we called a banana bag, which was a yellow color because it has a lot of those B vitamins in it. So we called it a banana bag. And you hang one of those in a liter of fluid and you're feeling a lot better.
yeah.
So that's, lots of different opportunities for different treatments there. So what are IV nutrient infusions? So to make it clear, these are not, in general, we're not putting medications through the intravenous. We're doing nutrients like different vitamins and amino acids. So that's a big difference. So because we're not using medications being stronger and having more potential for side effects, you have much less risk for having any kind of problems.
Yeah.
So you're going to be doing a lot of fluid, which is helpful for almost everybody because a lot of us don't drink enough water. And certainly in somebody with POTS, that's exactly, you need a lot of fluid. POTS, by the way, stands for postural orthostatic tachycardia syndrome. So in case anybody's wondering what we're talking about when we're talking about POTS.
Yeah, right. I guess we should clarify.
Yeah, right. Just thinking about that. Not everybody has followed and kind of knows your journey, but that's a big piece of it. Right?
Yeah, one of the primary things is dehydration. Your body has a hard time really holding on to any hydration. So, yeah, it's super good. And that's not the only condition that would have that type of problem, right? Any type of mineral imbalance or dysfunction of your nervous system can cause that. So it's for me it was like a lifesaver because of all the time I saved and the money I saved going to the ER.
Yes. Yeah.
Like it was really,
because you know any ER visit's going to be at least $1,000.
It just adds up.
And if you know what you need already, you don't go to an IV nutrient place to get diagnosed. First off, you have to be healthy. This is not or relatively healthy. This isn't if you've got something acute.
Yes.
But if you know that this is what you need, you've done this 5 times before, and you don't really need labs, you don't need physician's interference, then
and then some of the, like we're going to talk about, if you're coming off travel and you're not sure what you need, of course there's resources and we're explaining them.
Right.
But it's definitely something to try to see if it is a big needle mover. I mean, I've seen a lot of people really feel instantly better when they do the IVs.
Sure, exactly. Hey there, Michelle. Hey, Donna. Welcome to our IV nutrient talk. So we're talking about why you might need them and the difference of an IV nutrient infusion versus a medication. So in general, when we're doing the nutrient infusions, we're not using medications, except for sometimes we will use, for example, one of my little concoctions, one of my cocktails, is for people with hangovers. And so then we are going to use something like Zofran, which we can do intravenously. It helps settle your tummy, but doesn't make you sleepy. So that's going to be one of those situations where we would use a medicine. But in general, you're staying away from medications. Because the point is not to do a medical treatment. The point is to try to enhance your body's own nutrients, the fluid, and just enhance the performance of your body.
So how often do you recommend if people were to start pulling this into their routine?
It really depends on the individual and what their lifestyle is like. Some will do it once a week, some once a month, some just sporadically. So it could also be something that you do, for example, before a big sports event. If you're going to run a marathon, if you're training for some kind of big event, you might do one before the event. If you're doing some regular training, sometimes you'll do it after the event. Before the event, so that you've got more fluid on board, so that you've got all of your B vitamins, which are so important for energy and for exercise, are there. After the event, you might be doing it to recharge, right? Because your little mitochondria have been burnt out for that recovery, to get some amino acids to rebuild the muscle. Magnesium, because you don't want to have all the cramps after you've been doing a lot of sweating. So there are certainly athletic performance issues that you can use it for. You could use it if you're a traveler. So if you get a lot of jet lag, if you're traveling across time zones where you're going to have a circadian rhythm change, then you can really use it to benefit you, because when you're up in planes, you're losing a lot of fluid.
Yeah.
And so you really dehydrate more than you recognize, because the air up there is not as humid as the air is on the ground. And so we tend to lose a lot of body fluid.
Like a moisture suck.
Right. So that would be a reason. Hangovers would be another reason. You can use it if you know you've got insufficient nutrients. So maybe you're doing a nutritional test and you see that your B vitamins are very low. You might do it for that. And then you might do it regularly until you build up good B vitamins. So you could do that once a week. You could do it because you've got fibromyalgia. There's a lot of these, B vitamin nutrients are good for energy and good to help your nerves. And so fibromyalgia people tend to benefit from that. You can sometimes add in other things like glutathione that can help you if you have liver issues. You need some help supporting your liver's ability to detoxify. So that can be done also once a week or once a month. It really has to be personalized.
Yeah, and some people will just do it as an anti-aging method and longevity, right? So they might go in just to like have those extra nutrients, have the amino acids. And some people aren't getting the amino acids very well from their diet, you know?
Yeah.
And so the amount of things that, what is it good for as far as anti-aging? So your skin, the hydration in general alone, right?
Yeah. So the skin can really be helped by detoxifying. So glutathione really helps give you a better glow. It can really, that's one of the things that they look at for the skin issue. So when you're kind of clean your system out, and of course you're doing that hopefully through diet and exercise and sweating and doing all those good things that help your body to clean itself out. But if you want that extra little boost, the glutathione is great for that. Anti-aging pieces, there's still a lot to be learned. We're still doing a lot of research in that area to know what's really going to move the needle. But getting that good nutrition, making sure again that you've got plenty of the B's, and vitamin C actually can be a really great antioxidant. And those antioxidants are super important to things like telomere length. And so we think in the long term for aging.
And so you mentioned vitamin C. I know that one is, there's been a lot of stuff done around vitamin C, the high dose vitamin C in cancer treatment.
Right.
So I have friends that had cancer and were doing high dose vitamin C and making a significant difference. And I also want to can I touch on the glutamine piece?
Mm-hmm, sure.
So making sure that people with cancer recognize if they go to these IV therapy places, a lot of people don't realize that there's certain amino acids, like glutamine in particular, that you want to stay away from. So just in case you've been out there or you're doing that and you're over there and you're like, load me up, really the vitamin C is probably
a good one. And the glutamine piece has been kind of being watched, and they're doing some studies, and there's some studies coming back to show that it may not be as big of an issue, but until we really know better, you're just better to try to avoid that, because that may push your cancer, may help it grow, and we don't want that to happen. So, and with your cancer treatments, you want to always talk to the therapist or the person that's doing your IVs, because if you're in the midst of chemotherapy, you don't want to take a lot of antioxidants because you want the oxidant activity of your chemotherapeutic agents. So it really depends where you are in your cycles.
Yes. Okay. Thank you.
Yeah.
What else have I heard it used for? So people do the high dose vitamin C, the amino acids, and the vitamin B. So there's lots of different mixtures, right? So she was talking about her potions and stuff like that. When you go in, there's concoctions that are going to be really specific for all of these different things we're talking about. So like the hangover and the traveling, and then somebody who's using it for performance enhancement is going to be different than someone who's coming in for, you know, cancer therapy or fibromyalgia. You know, what are some of the different?
So you can also use it if you're you feel like you're coming down with a cold or the flu, so you can use it to boost your immune system. That's another really good one. And people with chronic low immunity can benefit from it, and people that usually have very good immunity, but for whatever reason, they feel like they're coming down with something, and you know, that's the thing, I can't be sick this weekend, right? Then you go in for your IV and get a boost, and you get on some other things that kind of help you to get over it really fast, so you can get on to whatever it is that you can't be sick for.
We're not talking about like that little Bio-C packet here. We're talking about like hardcore.
We're talking hardcore. And do not ask for antibiotics, because 9 times out of 10, when you can't be sick, it's going to be more viral. It's not going to be something bacterial. If it is, obviously you want to take antibiotics, but for your good old run-of-the-mill cold or influenza, antibiotics only harm you. It hurts your microbiome. It does not help. So stay away from those antibiotics unless you absolutely need them.
Yes, for sure.
That was my little side note there, because I have a thing about that.
After you're going through antibiotics, if you've been through something as a recovery tool, it wouldn't be bad to come in after you're done and kind of getting your body back in track. If you did face something, you know, definitely.
Sure.
Yeah.
There's definitely benefits with all of those. So other reasons can be you can just maybe need energy. Maybe you've been burning that midnight oil, you don't have a hangover, but you're really tired, and maybe you just need a little boost of your B vitamins.
Yeah, there's some executives, you know, that have just a rough crazy schedule,
Right.
and they're taking on too much.
And then there's something called NAD, nicotinamide, that you can also get as a shot or as an IV, that helps to boost your little mitochondria. So mitochondria are the little energy packets in your cells, and so sometimes their function goes down for a variety of reasons, and so this NAD can be a little boost to that.
Yes, and the mitochondria are deal breakers in longevity and
Deal breakers, yeah.
anti-aging. So you want your mitochondria happy.
You want them strong. Yes, absolutely. Now, another place where you can use IV nutrients is weight loss. Because sometimes when you're trying to lose weight, you really restrict your calories and you may not be getting enough of certain nutrients. So you can do an IV to help boost that. And then you can do, as kind of an adjunct to that, you can do a shot of something called MIC, M-I-C, and that stands for methionine, inositol, and choline. And those are 3 little nutrients that can help to kind of turn up your metabolism a little bit, so that when you're doing that, then you're burning a little bit more, and so that can help with weight loss.
Yeah, fantastic. And the amino acids too, I suspect would be good for that.
Right, exactly. Yeah, because often you're decreasing what you're eating, you may not be getting enough protein, and so you can boost your amino acids, get your B vitamins up, get your energy going, so you can go out there and exercise.
It's a shortcut, people.
Yeah, yeah. And remember, we were just at the biohacking conference, so we're learning all about these shortcuts that we can do.
Yes.
How to hack the body.
And you've been on this one for a while, so this has been if you haven't seen, we do have the grand opening of VIDA.
Mm-hmm.
So that is May 2nd.
May 8th.
I'm sorry, May 8th.
Yeah, May 8th, yeah.
What is May 2nd?
I don't know. Yeah.
May 8th. I'm sorry.
Yeah.
Don't listen to me.
Yeah, May 1st is, May Day.
May 8th is a Wednesday night.
Right, so Wednesday night, 6 to 8 o'clock in our office, we're going to have the grand opening, and we'll have food and wine and all kinds of raffles. So if you're local in town, then feel free to come on down. If you can, call us to let us know that you're coming, so I make sure I've got plenty of food and wine and other drinks. We won't just have wine, but we'll have all kinds of yummies and all kinds of free giveaways. So it'll be fun.
And cool people.
And cool people. Yes. So those are some of the reasons why you might do IV nutrients. So
hit us with some questions.
Yeah, we want some questions, people. So one of the things that I get asked all the time is, are they dangerous? And so in general, no. Even when we look at kind of things that have happened in nutrient infusion places, it's not the heart attacks, it's not, there's not bad things happening. There's generally not allergies happening because we're really not infusing any proteins, and proteins are what stimulate an allergic reaction.
Allergies.
So really worry about having hives or becoming allergic to something is really slim, if at all, in terms of a concern. So, and we've got all
you
the
might
stuff
have a side effect of energy.
Yeah, you might have some too much energy.
Well, and if you are low on B vitamins, sometimes you could be symptomatic and not even know it, right? And then all of a sudden you've got all these B vitamins that your body's like,
speeding.
Whoa, this is awesome.
Yeah.
You might, energy.
Right. And the way I think about it is, it's kind of like giving yourself an unfair advantage over other people around you that aren't doing that. So you want that unfair advantage so that you can make the best of your day-to-day life, right? So grab it while you can.
Yeah. So will there be like packages and things where they could, if they do more of a regular program? Right.
So we'll have like the one-off, so you can come in and try different things. We'll have a little menu board. But we're also going to have memberships, and so that you can become a member and then get a discount on things, and that membership will include certain things.
Awesome. Cool.
Yeah, so we're working at all those details, but we'll have those for you. So if you want to do it regularly, 2 or 3, 4 times a month, that you can do a membership and definitely get a benefit.
So Cheryl asked, if you don't keep it up, do you feel any withdrawal type issues?
No. So if you don't keep it up, it can be a one-off. You can do it once. And if you have an ongoing deficiency, then you may notice that, you felt great then, but then you go back and you're not feeling good. It's not like a withdrawal, though. It's just that your deficiency hasn't been met.
Your baseline.
Yeah, you're back to your kind of poor functioning baseline. And Nick says side effect of energy. Yes, that's good. Exactly, right? We want those
Who
good.
doesn't want energy, right?
Right? It's kind of like when you think about what are weeds. Weeds are just plants that grow someplace that you didn't want to grow there. They could be very beautiful flowers. But side effects are the same things. Side effects can be positive, except for we don't think of them, like energy, as being a side effect because it's a positive thing. But really, it is still a side effect of
yeah, because you definitely, you feel you don't want to see me on one of these things like in the morning and be so annoying.
Yeah. We've done them together, and she gets nice and
very quiet,
energetic. Yeah. It's all good. And how long do they last is another question that I typically get. And again, it depends on what your baseline is. If you are really deficient, you may find that you get some good results, but that after a few days or a week that you're kind of feeling back to what you were before, and that's then kind of a signal that you may want to come in like once a week. So I generally don't suggest more than once a week unless somebody's really is working with a physician that tells them that they need to do something more than that. But generally once a week, once every 2 weeks is a good time to do things.
And do you consider this like an additional therapy to regular supplements?
Yes. In fact, we will also kind of, for each package that we have or each cocktail that we have, so say we've got the one, we call it VIDA Loca Recovery. So that's one for hangovers or if you're that executive kind of going. So then we will have a few supplements that we're going to suggest for energy. So maybe like some CoQ10 and some other things that will help you to kind of continue feeling as good. So you can do some supplements in between when you come in for your IVs.
And what about stress management? So is there a particular, just for a stressed out person, some of these vitamin nutrients can impact cortisol and
yes,
rhythms?
Right, and all those rhythms, yeah. So then you're looking at one that's kind of more of a defender, more supporting your immune system. So your vitamin C, which is really important for your stress management, and your B vitamins. So we'll have little kind of combinations of that too. And if you're not sure what you want, you can talk to the nurse or myself that's here, and we can kind of come up with whatever is kind of special to your particular situation. Obviously my patients, I'll have some ideas because I already know their full history, but we'll try to help you kind of identify what would help you best.
Actually, David asked what goes inside. So there's going to be a variety of different...
Right, but it'll be vitamin C, it will be pretty much all the B vitamins, except for folate doesn't go in well into the IV, so generally the B vitamin complexes don't have folate, which is B9. It can have amino acids, it can have glutathione, you could do alpha lipoic acid, you can do magnesium, you can do calcium, so you can do some nice minerals, your copper, so you can get a really good mix of those minerals, especially for my athletes who kind of sweat it all out.
Yeah, and the B vitamins, it's B2, it's B3, it's B6. There's a lot of B vitamins, and in amino acids, there's a list of amino acids. So the glutathione is actually administered separately. It's not in the mix.
Right.
It's something that you add.
Because it's a very volatile
later.
molecule, and so you want to put it at near the end, and then we just give it kind of as what we call a slow push. Yeah.
And then why are some of them like better, maybe better or not better in like a shot form? So like B12, we do a lot of shots of B12. The NAD can be done both ways, and I think that really it's the time. Right.
So most of these things can be given both intravenously and as shots, as intramuscular shots or subcutaneous shots, but some things can't. So for example, the methionine and acetylcholine for the weight loss, you don't want to give a boost of that, you want it to stick around. So that's why you do it as a shot. So you want it to have some lasting effect. And so you're going to do it as a shot in the muscle because then it's going to stick around and kind of just slowly percolate through the system. Other things like the NAD, you can do as a shot or you can do it as an IV. The IV though, you have to do it very slowly. It takes 4 or 5 hours to run in a treatment for the IV. Otherwise, you can have some issues with palpitations and things like that. And then, let's see. So much
David,
talk about CBD oils, etc. Is that
I don't
something that they are doing? Curious. No, you're not doing any CBD oils intravenously. That's all. You either inhale it through a vape, or you're going to use it sublingually, or you're going to eat it. So that's not something we're doing intravenously. And then David asks,
Is it based on blood tests?
Is it based on blood tests? Yeah. So it can be, yes. So you can do a nutritional test and then come back, and you can have the blood drawn for the nutritional test, and then come back and have your intravenous done based on what your needs are. Absolutely. So we'll have packages with that too. Some people don't want to wait that 10 days, 2 weeks to get all that nutritional information back, and they just want to kind of come in, and then they'll just pick something off the menu board.
So if you do these and your body is absorbing nutrients, for instance, there's no risk of like overdose, right? So it's your body will just you basically pee it out.
Right. Yeah. So whatever your body can't use, it's going to pee out. So these are not, other than things like the methionine and acetylcholine that we want to stick around, they're generally, and that's sticking around slowly, and that's very safe. A lot of these other things, you're going to find that your body is just going to say, no, I've got enough of that, thank you very much, and you're going to pee it out.
Yeah, and then the stuff else, otherwise it's in your bloodstream now, it's going to utilize what they need to like make energy, to
make those little mitochondria
help with your muscle
work.
building and all the different things that are so beneficial, help you with your sleep, like energy, like all the things.
Right.
So yeah, I'm
And as a side note, we're talking a lot about energy because so many people come in with fatigue. When you're getting these, it's not making you like caffeine energetic. You can still sleep. It makes you like, all right, I've got energy to do things. It's not like, oh, I'm buzzing, I can't sit still kind of energy.
Like it's function.
It's function. I can get things done. My mind's flowing. I feel in a good space.
Yes.
Yeah.
Yes, for sure. Good clarity.
Yes. Yeah, exactly. You want that sense of resilience and being able to do things.
Any other questions, guys?
Some good questions here.
Yes, for sure.
So yeah, we're kind of hitting our time, but if anybody has any other questions, feel free to type it out, and we will do our best to get back to it and answer you on the Facebook page.
Yes, thank you so much for coming out tonight too.
Yeah, thank you.
Feel free to share if you are local, especially.
Right, if you're
but again,
local.
please RSVP, right?
Right, well, as much. I mean, if people don't, that's okay.
Yeah.
If you have an RSVP, don't feel that you can't come. If you find last minute that you're in the neighborhood and you're able to come on by. But if you know that you're planning on coming, then go ahead and RSVP, and we'll make sure we've got that extra little appetizer or glass of wine for you. And then some other news, we are going to be shifting from doing this once a week to doing this once a month. So we've got some ideas now that I've got a bigger space. We're going to do some events here locally in our space in the evenings, and do some talks and some outreach and some educational seminars, have some guest speakers. And we will continue to do this though once a month.
Yeah, and I think we'll probably do more pop-up type things. So we might jump on live, at the event, or if we're doing one of our talks, we might pop in then. So if you have like topics that you guys want us to cover, make sure that the ones that we're doing each month, that give us plenty of time to bring it to you the way that you want. And we appreciate that everybody who's been on every week and hanging out.
And supporting, yes. Supporting us and their friends. So as usual, please feel free to share with those you love, people you care about, so that they can learn what they can do to empower themselves and improve their health. We're on YouTube, on my channel there. We're here on Facebook, and we're here in the office. So come on down and check out the office and learn what we can do to help you improve your health. So for our next Facebook will not be next week because it's Easter Monday, and then it will be the week after, the 29th. So we're going to do the 29th of May, and then we won't be doing anything, the 29th of April. We will not be doing anything in May.
Yeah, so a lot of travel, and then we've got summer months coming up. But we thought that the last week in May, or of the month, the last Monday of the month, will be the most consistent moving forward for the rest of the year. So that night we know is going to be.
So the last week on a Monday, last Monday in June, the last Monday in July, the last Monday in August, and so forth and so forth. And if there has to be a change, we will, of course, always update you through Facebook messaging. Okay, so thank you guys. Thank you once again.
Thank you.
Have a wonderful evening, and I look forward to seeing you in a couple weeks.